Namaste everyone. Today we are discussing about the Krishnagata Rogas. That is fourth disease, the Ajakajat. So here is the sloka. Aja Purusha Pratimo Rujavana Sa Lohita Lohita Pichalashruhu Vidare Krishnam Prachobhya Paiti Tam Ajakajathamiti Yavasetha. That is the sloka Sushruta Uttarastantra, first chapter 10th sloka. So here Aja Purusha Pratimo means the growth which will appear as a Aja Purusha, that is excreta of Aja or goat. There will be a severe pain, Rujavana. Sa Lohita, Lohita means reddish, Rakta dosha. Lohita Pichilashruhu, that is the reddish sticky discharge will be seen. Vidare Krishnam, you have to consider here lacerated wound, that is known as Ajakajata. Its correlation anterior staphyloma or iris prolapse. Dosha Sushruta by the Raktaja and by the Vagbhata again same Raktaja. Dallahana, it is Kafaja dosha. So Sushruta named it as Ajaka Jata, Vagbhata is Ajaka. So here by seeing this Lakshanas of the Ajaka Jata Sushruta, because of Rakta dosha in the region of Krishna Mandala, there will be a reddish painful growth which resembling excreta of goat, having severe pain, reddish sticky discharge with perforation and local lacerated wound seen on the cornea. So here complete reddish discharge will be there, painful growth will be there, and perforation, lacerated wound will be there by the Sushruta. According to Vagbhata, Aja Purushavat Pitika. Aja Purushavat Pitika, same thing here. It involves in all the three layers, Prathama, Dvitiya and Tritiya Patala layer, and it is secondary to the Savana Shukra. If you are neglecting the Savana Shukra, improper treatment of Savana Shukra, that maybe leads to Ajaka Jata. And it occurs due to the Netrabhighata. Any injuries or any trauma may leads to the Ajakajata. Sadhya Sadhata, it is Asadhya Vyadhi. Treatment Chikitsa, Snehana with Triflagurta, Nasya, same thing, and Anjana with Narikelasthi, Rakta Mokshana, Agni Karma Suvana Shalaka, and Shastra Karma can be advised. Here Shastra Karma, here you have to pierce with the needle at the lateral part of the cornea, remove all the content, infected fluid or mass from the cornea, and Purana filling therapy can be done here with Gomamsa Churna and Grutha. And after that you have to do the Bandhana Karma, bandaging. After 7 days you have to remove the Bandhana, that is bandage, and advise the patient to take the Nasya with Kshirasarpi. According to Yoga Ratnakara, he advised Shiramokshana, Rechanu Trivritleha, then Ashotana Tarpana Seka with Vatahara Dravyas, Vatahara Grutas can be taken here. Netra Puran also advised periosteum of cow's bones plus lukewarm water grinded well, and Purana Karma can be done here. Shambhuka Gruta, Shambhuka Mamsarasa or Shashakat Gruta Pana can be advised here. So according to modern, it is a keratitis. Inflammation of cornea is known as keratitis. It is classified as topographical classification and etiological classifications. Topographical classification, it is two types, ulcerative keratitis and non-ulcerative keratitis. In ulcerative keratitis, it is also named as corneal ulcer. It is divided as four types, depending upon location, depending upon purulence, depending upon hypopion, and depending upon depth of the ulcer. It is divided. Non-ulcerative keratitis, it is a superficial keratitis, and second one it is deep keratitis. Again, deep keratitis are divided as two types, non-suppurative keratitis and suppurative keratitis. So these are the flowchart of the classification of the keratitis. That may be important question, that may be asked for 2 marks. What is keratitis? Then you have to write the definition of the keratitis and all the classification of the keratitis. That is very important. Just remember the chart for your convenient purpose. Second one is the etiological classification. So in etiological classification, again it is divided as a infective keratitis, allergic keratitis, trophic keratitis, traumatic keratitis, and idiopathic keratitis. Again it is subdivided many types here, but you have to remember the main headings, right? All the 5 names you have to remember. Infective keratitis, that in that bacterial keratitis, viral keratitis, fungal keratitis, chlamydial, and Parochital. Those two are the bacterial variety. So all the infection will be bacteria. So in allergic, fictinular keratitis and vernal keratitis, atrophic keratitis. In tropic keratitis, exposure keratitis, neuroparalytic keratitis, keratomalacia, and atheromatous ulcers, traumatic keratitis. In idiopathic keratitis, very important thing will be the Murray's corneal ulcer is very important. That may be asked in Viva and PGCT. What is Murray's ulcer or corneal ulcer? They may be asked. In keratoconus, it's very important. They may be asked at 2 marks. Here, what is the definition of the keratoconus? Conical shape of the cornea. It is a non-inflammatory bilateral ectatic condition of cornea. Ectatic condition means thinning of the cornea. It starts in puberty and progresses slowly. Generally, it appears in puberty age, and it is slowly progression, having the slowly progressions. Etiology: it is hereditary, endocrine abnormalities, and defective in synthesis of polysaccharides and collagen tissues may lead to the keratoconus. So here main symptoms in that: defective vision, progressive myopia, irregular astigmatism. Signs here, Munson's signs, very important thing here. You have to tell the patient to look down. You have to retract the upper eyelid. Lower eyelid will be bulged. That sign will be Munson's signs. Depend upon size and thick shape of the cornea. Cornea divided as a nipple, oval, and a globus type of keratoconus. Nipple, it is less than 5 mm and strip in curvature. Oval, it is 5 to 6 mm ellipsoid in shape. Globus more than 6, and it is globus shapes. There will be for this purpose treatment can be advised. Rigid contact lens penetrating keratoplasty can be advised. Keratoglobus, it is hereditary bilateral congenital deformity, thinning of the hemispherical protrusion of the cornea known as keratoglobus. So keratoplasty, it is also asked for 2 marks. Keratoplasty, corneal grafting or corneal transplantation is called as keratoplasty. The definition here: diseased cornea is replaced by the donor's healthy clear cornea. That's the definition. Types here: penetrating keratoplasty and lamellar keratoplasty. Penetrating keratoplasty means it is a thick grafting, and lamellar, it is partial grafting. So here where the keratoplasty can be indicated, that is improve vision, corneal opacity, corneal dystrophies, keratomalacia, corneal protrusion, corneal thinning. In these cases you have to advise the keratoplasty. And eye donation, you have to remember the eye donation, it's very important here. Removal of the eyeball within 6 hours of death. If the patient died within 6 hours, you have to remove the cornea or eyeball. It is graded or depend upon the layers: excellent, very good, fair, and poor. All the depend upon all the 5 layers of cornea is present, then it is excellent. If the 1 layer is missing, then it is called as poor. So here how to make the preservation of the collected eye. That is short-term storage up to 48 hours. It may be kept in 4 degrees Celsius. Intermediate chamber, up to 2 weeks you have to preserve. MK chamber, or maybe chondroitin sulfate medium, or that is aptasol medium you have to get. Long-term storage, that is up to 35 days you have to keep. That is the organ culture method. So these are the storage, right? Thank you.